This comes as a surge at the area's hospital is making things very difficult, mirroring the situation nationwide. According to the Illinois Department of Public Health, just yesterday, there were more than 4,000 COVID patients hospitalized in Illinois. That's almost double the amount of COVID hospitalizations at the beginning of this month. Joining us to discuss this surge are Dr. Clifton Clark, Vice President and Chief Medical Officer at Advocate Illinois Masonic Medical Center, and Dr. Susan Bleasdale, Chief Quality Officer at the University of Illinois at Chicago Health System, or UI Health. She's also an infectious disease doctor. Welcome both of you to Chicago tonight. Dr. Bleasdale, I know you were at this press conference earlier today. You said that about 18% of ICU beds across the state are available right now. What is the status at UI Health?
So, our ICU capacity is dynamic. It changes. But right now we are seeing a significant increase, and at different points during the day, we will not have an open bed within our intensive care unit. We continue to evaluate it on an hour-by-hour basis as people transition in between needing intensive care and not further needing it, and thinking through who can be transferred out. And so it's a dynamic situation, but it is at different points during the last few days with this increases, we are full in our intensive care units.
A fluid and stressful situation. Dr. Clark, how about throughout the Advocate system? Is it the same situation? And what does that mean for patients that perhaps have other ailments that need to be in intensive care?
Yeah, it's very similar. We have very widely fluctuating volumes in our ICUs, but we have been very full. It makes it very difficult for folks with other diagnoses to get in. There's a backlog in our emergency departments because we can't get patients admitted to the ICUs or to our general medical floors. So it's really impacting all healthcare that we can deliver in the hospital setting.
And Dr. Bleasdale, give us a sense of how hospital staff is coping right now. Is there burnout, and is there enough supply here of workers to meet the demand?
Well, I think overall, we as a community at large are burned out from the pandemic, and of course, healthcare workers even more so. I think that the other issue that we're strained with right now is because of the ongoing community transmission, we're seeing our healthcare workers are affected by this within their families, within themselves, not from work-related exposures, but just because of community transmission. And so because of that, we have the increased capacity needs for our patients within the hospital, but we also are worried about the potential increase in the need for staffing because people are acquiring infection even when they are vaccinated and boosted, that they can have it mild, but that still takes them out of work if they acquire infection, unfortunately.
So you have to worry about infection among your staff. Dr. Clark, what about throughout the Advocate system? Do you see fatigue? Do you see nurses leaving their jobs, doctors able to keep up with the demand?
Yeah, this latest COVID surge really continues to take a toll on our workforce, and these team members have been working very hard, very skillfully, with great compassion to take care of our communities throughout the pandemic. And as time goes on, it takes more and more of a toll on them. So yes, we do see nurses and others leaving the workforce, but we have a very dedicated workforce as well. And despite some of these challenges, as an integrated health system, we have some flexibility to move around resources like staff, as well as equipment and supplies where it's needed and when it's needed. So we do have some flexibility there, but it's getting more and more difficult as the caseloads continue to increase everywhere.
And Dr. Bleasdale, many public officials have made the point that at this point it is a pandemic of the unvaccinated, especially when it comes to serious illness. Is that what you see at your hospital, that most hospitalized are either unvaccinated entirely or don't have the booster?
I would say yes, those that are hospitalized, but I do want to make sure that people still take caution. There is a sense that if you're vaccinated and boosted, you cannot get infection. And I would say that that's not the case. Really the vaccination and the boosting helps prevent that hospitalization, that severe disease, the risk of dying from infection. And that is really important why people need to get vaccinated. But even for those of us that are vaccinated and boosted, we need to use caution right now because of the high transmissibility of this. And we don't want to get this because this will maybe not make us very sick, but might take us out of work, might expose those that are vulnerable that might end up in the hospital. Really important.
Dr. Clark, the Omicron variant has rapidly taken over. Some charts today showing that even in the last week to 2 weeks, it's become the vast majority of the cases when it was barely even a percentage. So how worried are you and other healthcare providers with this, with holiday gatherings and travel on the horizon?
In our system, as of yesterday, we had a 1 week increase in our inpatient COVID population of 11%, and over the last month, over 100%. So it's a huge issue. I will echo what Dr. Bleasdale was saying, that we really just need to encourage everyone to get vaccinated, to get boosted. And it's very important that we still continue to be vigilant with our masking and our distancing as appropriate. So that would be the message. And I guess we need to really make sure that we stress that to everyone.
Dr. Bleasdale, are we headed toward a crisis given the capacity limits now and the rapid spread of this Omicron?
Things are happening very fast. That's concerning. And we're hoping and appealing to everyone to use caution, to get vaccinated, to keep your masks on, and hopefully that will slow things. But it is concerning because the rate of increases is much faster than we've ever seen throughout the pandemic, unfortunately. So I'm fearful that we may be facing a crisis if we can't slow this transmission.
All right, we'll have to leave it there. A lot to think about. Our thanks to Dr. Clifton Clark and Dr. Susan Bleasdale for joining us. Thanks so much.
Thanks for having us.
Thank you.